Prior to the cooperative getting started, I was the director of the Waushara County Human Services Department, and one of our responsibilities was to provide home care, the idea being that people are better off if they can stay in their own homes and get the kind of support that they need so that they don't have to be placed in a nursing home or some other institution. We had one of the highest rates of people over 80, I think, in the state. Plus, we're a very low income county. So consequently, the number of people who were aging was increasing, and the number of people who needed support and financial support from some of the state and federal programs was increasing. And we just had a whole sort of fleet, I guess you could say, of people who provided home care. Donna was one of them. Mm-hmm. And we had a person who managed them, and she actually had a recipe box that was full of people's names and numbers. And if one of the social workers would come and say, you know, Mrs. Smith really needs somebody to come in and you know, maybe help her out with the shopping or cleaning or taking her to the doctor, these sorts of things, then the person who was the coordinator would go through a recipe box. And then we were concerned because we were having trouble recruiting home care providers. And just by chance, I happened to talk with somebody in Madison who had heard a presentation about the co-op in New York, where the people would provide home care. And I thought to myself, you know, that sounds like a good idea. A lot of people said, well, it wouldn't work in a rural area, and we thought, why not? I mean, there's farmers co-ops, there's electric co-ops, there's all these kinds. It should certainly work here. And then we got sort of hooked up with the cooperative development specialist out of the USDA, Margaret Bow, whose job was creating co-ops, and so she helped us out, and we got everybody together that was providing home care. We had a mandatory meeting. You know, you got to be there. You're not going to get paid. So everybody came, and they had a presentation on cooperatives, and we had a lot of discussion. And pretty much the group was asked if they were interested in going ahead, and everybody was. So. We got volunteers for a steering committee.
I had started doing home care and was in that, my name was in that recipe box that Lou was talking about. But I always thought the wages were very low, but I loved the work. And so I think I was like a lot of other people in the area in Waushara County. A lot of the younger girls that I knew that did home care, I knew had families, and my heart went out to them, you know, that they should have a better deal. So it was scary to think about going into a business for yourselves, because most of us were just home care people or raised families, and we weren't business people.
The Human Services Department, we were still paying for the home care services, but what we had to calculate was, you know, how much more could we pay so that the wages would be brought up at least to a living wage. So the co-op really had to have some startup money to rent a place, to hire support staff and that type of thing. But we did manage to get our budget passed.
We collected $40 from 63 members. Now, if you do your calculations there, it's not a whole lot of money to start a business. And through the grant, you matched that $40, I remember that.
Right,
and
we did get a grant from the state to assist in the planning, and some of the people couldn't afford the $40. So we had some payment plans where people paid $10 a month in order to become a member. So that kind of gives you an idea of the income level of many of the people. We were fortunate that we were able to tap into, you know, some expertise, particularly from the rural development folks. And other co-ops around the state have been very, very helpful in doing that. But I always said, you know, we were looking at it from sort of a self-preservation viewpoint, and pretty much all we did was open the door, and the co-op people walked through and took it from there.